and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Last week, the government released a white paper proposing a new voluntary medical insurance plan. Now, the base plan would be risk-rated with premiums based on factors like age, gender, and health status, and it's expected to cover individuals up to the age of 85. Now, the base plan is expected to be rolled out early next year. So what questions should we as Malaysians be asking about it before then? Joining me on the show now is Azrul Mohd Khalib, who's the CEO of Galen Centre for Health and Social Policy. Azrul, always good to have you on the show. Now, help us think through this because it's been released, but there are gaps in the information that was provided. So very broadly, what exactly is this white paper proposing and how might it be different from the insurance options that people already have currently?
Thank you, Melissa, and thank you for having me. It's always a pleasure to be on your show. And I can say with regards to the base medical health insurance and takaful product is that we are seeing there to be what we would want to consider a baseline or a standard minimum for whatever that is available currently in the health insurance packages that are available, or products as we call them, out there in the market. So basically, if you can imagine that if you were looking for the bare minimum of any kind of insurance product that's available out there, even if you would consider yourself not being able to afford more expensive one, the one that you could basically say is something that you could be relied upon to be the standard would be what is being proposed today by the government in the white paper that they have presented, outlining a plan for the introduction of a base MHIT product that would then be taken up or offered by the insurance and takaful organizations or ITOs that will be asked to offer these to people like
Right. So just so I understand correctly, so the government is not offering insurance. The government is saying to existing operators, you must offer this base minimum program is it targeted for people who are not already covered by insurance or who don't have any insurance coverage?
Exactly, Melissa. First of all, it's very important to clarify that the government is not offering an insurance product, a health insurance product, which is actually outlined here is really for the ITOs to consider to offer to the consumers. So it's also optional. It's not required by Bank Negara or the government to the ITOs to offer to everyone. But this should actually cater for everyone, really, when you think about who should be able to access, meaning whether you have insurance or you don't have insurance, or you're thinking about changing to a new policy. This is considered one of the options that you can select from.
Okay, all right. So when you read the white paper, Azrul, what were your impressions, your initial impressions? Specifically, what was your biggest concern?
Well, Melissa, one of the things we have to be very clear about is that this is not, first of all, national health and social insurance for something that we've been advocating for quite a while. But this is also not something that is intended to accommodate everyone in the market, meaning if you are less of lower income and so forth, this product is not aimed at you. It would be something that would be considered for lower middle class and those above. So when we look at the white paper outlining this plan, there are quite a number of things that jumped up at us. And one of the key questions that we were asking is, how does this compare against the products that are already in the market of the similar range, the similar options that are available for consumers? And this is where we come to questions that we need to consider, which is, are we talking about whether the base MHIT program is the most generous insurance option available? That shouldn't be the question. It should be whether it improves the existing landscape of health protection. Because the fact of the matter is what is being proposed I believe, does not improve on the health protection. In fact, when you look at the other products of similar strata and kind, there are actually better ones out there that are being offered by, the ITOs, the private health insurance companies. So, when the Bank Negara or government says that they want to use this product to shake up the health insurance sector, to raise the floor, to disrupt, I think, unfortunately, in this instance, it will not be able to do so, because there are actually better products out there that are providing better protection at similar premium price range, and without the kind of clauses that are embedded within this particular plan.
So what do you think it is? I mean, what is it? Is it the fact that there's coverage limits, or is it the premiums? What makes it not as competitive or not as attractive as what's already out there, and not the game changer it started to be?
It is quite unfortunate, because we were actually hoping and expecting something of that nature. But the reality is that when somebody is shopping around for insurance, there are quite a number of questions that you are going to be asking. Very well, if you are of a certain means, you want to see how much are you going to be paying each month. And then also you're seeing how much cover is there annually, in terms of the offer that's being provided. So there's been a lot of discussion in the media right now after the launch that, you're paying less than what is available out there. So you're paying like 50 ringgit for Standard Plus. So there are two plans, Standard and Standard Plus. And one offers 100,000 ringgit annual policy limit. The other one offers around 300,000. So if you are going for the Standard Plus, you would pay basically a premium of 50 to 70 ringgit, and your annual limit is 300,000. But therein lies the clauses here, because when you are shopping around, you may not realize that there are things called deductibles and copay that comes into play. And deductibles and copay are really here to stay for the health insurance industry, really, because it's a way for us as consumers to also take part, contribute, and to ensure that there is ownership of our own health treatment, so that not everything goes to the insurance company and the insurance company has to pay for everything. So we're also judiciously deciding when we need that kind of treatment. So herein lies the problem, because when you look at the deductible for the Standard Plus, it's around 500 ringgit, which is, presumably okay. But the Standard Plus is a real shock, really, because it involves 10,000 ringgit to 15,000 ringgit deductible that you are basically needing to pay before you get treatment, before you get the insurance to cover for you. You have to pay 10 or 15,000 ringgit in advance, simply for having a premium of around 50 ringgit. The Standard plan offers around 80 to 120 ringgit monthly premium. So when you look at other packages, products available by, the ITO players out there, AIA, Prudential, Allianz, GE, so forth, they're all offering packages which actually pay less than that amount of maybe 70 or 50 ringgit. And guess what? They also have 1 million ringgit annual limits, or 1.5 million annual limits, and the deductibles maybe around 500 ringgit or 1,000 ringgit. So this plan that is being proposed by Bank Negara is asking a lot from people to be able to qualify for the Standard Plus plan. But Melisa, you know what? I'm reminded of a piece of statistic that Bank Negara shared not too long ago, which looked at, in an emergency, what is the proportion of Malaysian households that are able to put together 1,000 ringgit in an emergency, and back in 2021, that was around 40%. Only so 40% of Malaysians couldn't gather 1,000 ringgit in emergency. 2024, the data had risen to 61% of Malaysians are unable to gather 1,000 ringgit in an emergency. So when you have deductibles that 10,000 ringgit to 15,000 ringgit, you've got to ask yourself who's going to be able to afford this.
Yeah.
The other question that we also have to really ask reasonably is this strange age band that exists in the white paper. The age band identifies 31 to 35 years of age, 61, 65 years of age, and above 75 years. So the question is, what happened to everyone below the age of 30? What happened to people between the ages of 36 to 60? Are they not covered at all in this plan? Because they're missing. So we're very interested to know, what about these people? Is the plan not going to cover them? So this is one of the issues that we're concerned about, because it, for an insurance plan, it's supposed to be the base. It is certainly not the base that we're seeing here right now.
Right. Okay, so as I understand it, there are still questions that need to be sufficiently explained. There's still clarity that needs to be given, particularly the missing age brackets that you mentioned, Azrul. But when we look at the bigger scheme of things, so the government says this is all part of a bigger reset for national reform of the healthcare sector. Can you situate this for me? How does this fit into the bigger plan? Does this base MHIT plan actually reduce medical inflation? Does it reduce pressure on public hospitals? Where is the benefit of this?
So, Melissa, we very clearly say that this base MHIT plan has the potential to introduce positive disruption to the health insurance landscape, as it were, because it's not just about insurance. There's also things like the cost that occurs within the private hospitals. How much of that is going to be borne by the consumer or the patient? How much of that is by insurance and so forth? So you want to be able to introduce a realistic product that takes everything into consideration, especially since we've been told that medical inflation for this year is going to rise to 60%. It's going to be 16% this year in terms of medical inflation. But the fact of the matter is that these insurance premiums, they don't exist in a vacuum. The fact is that there are other costs involved. There are root drivers of medical inflation, which include things like weak or absent regulation of pricing, limited disclosure of fees, variation in terms of clinical practice, not one size fits all, rising costs of medical consumables. Although I'm hoping that with the US dollar weakening against ringgit now, maybe we can gain some benefit from that. Don't forget expertise. Expertise is expensive. We have to pay for that. Increasing domestic and international demand. And of course, all of this contributes to an escalation into hospital billing. So that then transfers to the insurance premiums that we have to pay, because the insurer or the takaful providers are having to pay for that. So the problem here is that it's part of a continuum, definitely. We feel that the reset framework, as it is, need to rethink, because at the moment there's some weaknesses in there. The fact of the matter is, until today, Melissa, neither the insurance or takaful players have issued a statement to indicate whether they support, do not support, or even say this is something interesting that they should be looking at. We have heard nothing from the insurance and takaful players in the industry. So that tells you quite a bit of where we are in terms of how the industry is looking at this. But my concern here, less of the industry lah. It's really about Malaysians themselves, because we don't want a situation where Malaysians who purchase the plan, they think they're protected, and then only to discover that they're uninsured when illness strikes, and then it forces them back onto out-of-pocket payments or even the public queues at the public hospital. So we don't want this false sense of security, right? So we need to see what's covered and what's not covered in the base MHIT plan, and whether or not this should be the standard. And I would argue it shouldn't be the standard, because the standard is poorer than what we have in the market today. This isn't about the most luxurious plan. It's about what fills our basic needs, and you see that some of the IPOs are offering 60, 70 ringgit and 80 ringgit premiums, and they offer better than what you can see here on the base MHIT plan. Maybe those should be the base MHIT or the standard that we should look at. So we really call for Bank Negara to relook at this base MHIT plan, because we feel that it can further be improved upon. It's not about adding more features into that, but adding more value. And one critical question here we need to really answer, Melissa, is with regards to the older people, those who are above the age of 60, whom we're very, very concerned about and seem to be left out in terms of in the cold, as it were, with regards to how much they're going to have to pay. If you look at how much a person who's above the age of 61 is going to have to pay under this plan, under the standard plan, they're going to pay upwards of 280 and above, all the way up to around 800 ringgit. Or in the standard plus plan, don't forget the one that has a 10K and 15K deductible, they pay 220 ringgit each month. This is for those above the age of 60. And here's the worry, Melissa, is that they're not able to afford those premiums. 200 ringgit is a lot of money for a retiree, a person who may not be earning much income at that point in time. And then it's almost worsened by the fact that there is a deductible that is 10,000 ringgit, 15,000 ringgit, for which they have to pay first. So we need to ensure that the older people are able to be protected because they are more vulnerable to the kind of pressures the private sector has to deal with. But also, at the end of the day, they're the ones who would be considered undesirable. So we would suggest perhaps there should be even subsidies by the government to help pay for those who are above the 60-year age band, therefore allowing them to benefit from the coverage of this base MHIT product.
Right. Azrul, thank you so much for helping us think this through. It's really complex and I appreciate you explaining it to us. Azrul Mohd Khalib there from the Galen Centre for Health and Social Policy. We're going to take a quick break here and consider this. We'll be back with more. Stay tuned. Hi, welcome back to Consider This. I'm Melisa Idris. Let's continue our discussion about Bank Negara's proposal for introducing a base medical and health insurance takaful plan, also known as the base MHIT plan. Joining us on the show now is Professor Dr. Sharifa Ezat Puteh, who is a professor of public health medicine at UKM's Faculty of Medicine. She's also the Dean of the School of Liberal Science there. Prof, thank you so much for joining me on the show today. So tell me, when you first read the white paper, what was your initial reaction? What did you think about what was being proposed?
Yeah, thank you so much, Melisa, for having me here. I think the white paper, which was proposed by sort of Ministry of Health, of course, it was a collaboration of experts as well, about 2 years ago, 2022. So the white paper sort of designated a few pillars how to strengthen the so-called healthcare in Malaysia. And of course, it will include, definitely will include not only the public, but also the private sector. And one of the strengths of this white paper, not only that it takes into considerations of working together, but also it looks at future healthcare reforms and how to tackle not only things like aging, NCD, but also emerging diseases. So these are some of the strengths of the white paper. Not only is it timely, but it is also used as, the roadmap ahead for healthcare in Malaysia. Yeah.
So if we were to look at the base MHIT plan that's now being proposed, and the idea is that it will maybe provide some insurance cover for the people who don't have insurance cover, don't have enough insurance cover. There are people who have come out to raise concerns about how the plan is designed. There are some people who say this is a great first step. Where do you sit, Prof? Do you see benefits in introducing this plan now? Do you see risks in the way it was designed?
Right. Okay. This perspective is more of myself. Yeah. And of course, I look at, published literatures and sorts on answering this forward. if Malaysia is to go forward with the Malaysia healthcare reform, and some of the proposed area would be to include some sort of premiums by certain population. Now, this premium can cover a lot of population. In general, we have so-called the lower income, the middle income, and of course, we have what we always say as the T20 or the top-level income earners. Now, this is not a problem for the top-level income earners. They can always go into their private health insurance or their coverage by their own providers. So this is not an issue. So more of the plan by Bank Negara, so-called, so the MHIT, or this will also include some of the micro insurance for the lower and also middle income population. Now, of course, the lowest income of those and also the persons who do not or not able to pay premium for certain reasons, these are basically covered by the government. So the public sector is going to be there as a safety net as well. So having said that, it's not to say that I do understand that not all of us can actually pay premium for certain reason. Now, this very much depend on your, income level and whether you're willing to pay and things like that. So the insurance by right, they should also cover not only the lower income or also the middle level income, but also the top level income earners who are able to pay more premium. So in a way, the coverage will cover all of these. But of course, the benefit will also depend on how much you pay the premium, right? I mean, looking at, even in the private sector, this very much depends on your premium level and the coverage that it brings. But coming from the so-called the Bank Negara and also the MHIT, I foresee that they will have more coverage, some of these things, example, for essential drugs, essential medicine, and of course, essential procedures. This will be covered through some of the benefit packages by this insurance premium. Right. The premium will be the tricky part because, we can always say that you pay premium, but how much, what is the level that people are able to pay, comfortably without breaking the bank, and things like that. But of course, this fund, the central fund will be used to sort of cover or reimburse the providers that's going to provide services for the population.
Right. So do you think it's a good idea? Because we've been having conversations about the rising medical inflation, the burden on the public sector, health care. How would this help the broader reform agenda? How does this move the conversation from? How does this change the game in any sense of the word, Doctor?
Okay. If you look at in general, for those who are paying or going to pay the premium later on, there will be packages or what we call as benefit packages that will be covered, that will cover this population. They will be able to access healthcare providers which are in the package, meaning that if, let's say, if you want to go into a private hospital, as long as these private hospitals are also engaged in providing healthcare for the MHIT premium providers, the population are able to go and seek services even in the primary care or in the private hospitals. So then it depends on the benefit packages, of course, and also how much premium that you actually pay. So this very much depend on that. But you are able to have more options, meaning that at the moment now, let's say I am a lower income population or a middle income population, right, my access would only be to the public providers, right? Okay. And this is one of the reasons why, there's a long queue, there's so many dissatisfaction, some of the drugs may be too generic and there's so many complaints about this. But what happens is that once you have so-called the premiums, for those who are paying the premiums, they will have more options. So there will be not only the public providers, but also they are able to engage private providers who are in the sort of medical card. So then you have more options to go to the private sector nearest to you. At the moment, if I'm a middle income or lower income and I don't have private health insurance or my employer does not pay for me, I'm not able to access private healthcare.
Okay, so this is one of the, I guess, tools the government is rolling out to help people maybe alleviate some of the burden on the public healthcare system. But I want to ask you, the devil is in the details, and it's all about implementation for this. If I understand correctly, they're looking to roll out this plan next year. What do you think needs to be clarified in the time period in between, or what needs to be refined to make sure that it achieves what it is setting out to do?
Right. I think more information needs to be disseminated to the population. Not a lot of people sort of aware of this. And we must engage the media, not only, example, Melisa, you are in the media as well, and also some NGOs who are able to correctly point out that this premium by right, there is still a safety net, which is the public providers. But for those who are able to pay premium or they have coverage by their employers, this is actually a benefit because then they will be able to have access to more providers, either the public or the private. And this would give more choice and they are able to seek healthcare, a wider choice, but also I think it will be faster in some sense. But then you correctly pointed out, the devil is in the details. So we must make sure the matching of the population income with the premium. We don't want, a premium that is too high for certain level of population. Example, if you're earning just 2,000 per month, you're not able to pay a monthly of, let's say, 100 premium per month, example. So the matching of the premium level and also the population must be there. So this is more targeted towards, a certain amount of income. So the middle level income definitely, and also maybe even the lower income, but they are sort of the upper lower income, they are able to pay premium or they are covered by their employers. So with that clarity needs to be there because people are doubting whether how big is the premium that you have to pay, and people are scared because there's a lot of insurance now that incurs a high premium. In the end, that most of these are, they have to cancel their account or whatever because they are not able to sustain the premium level that is being imposed on them.
Right.
So this is some of the things. Yeah.
And a quick one. I understand that it is all the way. It will cover people all the way up to the age of 85. Why is that significant, Prof?
I think this is very important because the one that consume some of the most healthcare in general would be the elderly. And this is where all of us are going to go at one point in time. And Malaysia, as you know, are already transitioning into the aging population sort of level, where you have a high number of people aged 60 and above or 65 and above, depending on which country you are. So they are the ones that consume most of the, healthcare being, they are imposed with chronic diseases. They have the least immune system. And this is where the inpatient care becomes a burden for a lot of people. So I think that coverage is very important, having an insurance coverage for elderly as well. Most of the private healthcare, because they are risk rated, Melisa, they do not actually cover elderly care because they have all these existing problems. You have your osteoarthritis, you have prior cesarean, you have blah, 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 and so on. So they don't actually include elderly or people who have existing diseases into the network. So what happens most of the time, example, in certain countries such as South Korea and things like that, even though you're elderly, you were covered before, but once you age a certain age or you have some very chronic diseases, you are being opted out and you have to pay yourself. So now this is the problem. So that will lead to catastrophic health expenditure, and this is something that we don't want to happen to Malaysian population.
Definitely. Prof, thank you so much for your time. I really appreciate you joining us and sharing some of your insights. That was Professor Dr. Sharifa Ezat Puteh, who's wrapping up this episode of Consider This. I'm Melisa Idris signing off for the evening. Thank you so much for watching and good night.